doctor. Can't you see I'm burning, burning? No, we're not talking about music today. We're actually sharing data about the likelihood LGBTQ plus folks will be burning through all of their money because of a medical issue.
You're listening to Queer Money episode number 371, and today we're sharing data from the Motley Fool Jeffrey Guy's LGBTQ plus money study about the state of healthcare in the LGBTQ plus community.
Now, on with the show.
Does it say something about me, David, that when I hear that song, I'm always thinking about what exactly is burning? Is there a medical issue there?
Right. Let's hope not. It's burning love, right?
Okay,
It's burning love.
Uncle burning love.
Right. Exactly. All right. So we said we were going to be talking about healthcare, the state of healthcare for the LGBTQ plus community, and some great data, some really good data came out of the Motley Fool Debt-Free Guys LGBTQ plus money study. And one of those points is that 49% of us, of the respondents on the survey, or the majority in each of the groups of the L's, the G's, the B's, the T's, the Q's, say that they have employer-sponsored healthcare insurance, which is great. That's awesome that 49% of people say that they have their healthcare through an employer.
Exactly. And then on top of that, 38% have healthcare through the open market or the open exchange. And this includes every category: the L's, the G's, the B's, the T's, the Q's.
Right.
So that's
like
good
I
news.
said,
Like I
said, it's great news, because really what this is telling us is that roughly about 86, almost 87% of LGBTQ people do have healthcare insurance. That's why I mentioned in the outset that it's the likelihood of us burning through a lot of the money that we have because we don't have health insurance is minimizing and starting to drop in our community.
But we still have progress to make, right? Because
Yeah.
you just looked up recently that we're still underperforming relative to the general population, right?
Right, exactly. General population, roughly 9.2% of the general population does not have health care. So we're lagging behind, but not significantly, which is a good thing, right? And so you may want to ask yourself why do folks not have health care? Well, oftentimes the reason why folks don't have health care is, even though they may have access to it through the open exchange, they still simply cannot afford it.
Yeah, Affordable Care Act is not affordable. It's
Well,
still,
and
as people who pay for our own healthcare through the open market, it's a big dig to our income every year.
It is, and I will say that we probably were more than fortunate with the company that I worked for prior to going on my own, because our health care insurance was really, we had amazing, not only coverage, but the cost of it was really low for us.
I think it's important to note that the survey that we took with the Motley Fool was taken before Biden signed the climate and healthcare legislation from 2022 that will hopefully help close some of this gap, but I guess it remains to be seen. But hopefully that legislation will expand healthcare to more people, even those who are sort of in this gray area where they can still purchase it on the open market. They can't get healthcare for free, but it's also still unaffordable.
Yeah, and this may be a commercial I saw earlier. I think actually either late last year or earlier this year. No, it was late last year, of an individual. It was a healthcare.gov commercial, had an individual talking about how he was paying $0 for his healthcare. Another commercial showed someone saying they were paying $14 a month. So hopefully that has, I think that one of the big complaints is that the Affordable Care Act wasn't necessarily affordable for a lot of people, and that the costs kept going up, and that we were kind of sold on this idea that because there's a larger pool of people paying into healthcare overall, that those costs should come down. Well, that didn't transpire, and now the government is acting on that. So
hopefully this legislation will fix that.
Yeah, exactly.
So stay tuned for your Queer Money takeaway from this episode.
Thanks for listening to another bonus episode. Here's your Queer Money takeaway. This week, we want you to focus on gratitude, gratitude, gratitude. We need to express gratitude for what we have. So especially for those of you who have healthcare insurance through your employer or through the open exchange, please express that kind of gratitude. It's really important for us to do that.
It's also good for your healthcare. Then join us next Tuesday when we answer a listener's question, and then next Thursday for another bonus Queer Money episode supporting the Motley Fool Debt Free Guys LGBTQ+ Money Study. Thank you and have a great weekend.